Welcome to the Our Forever Smiles podcast, a podcast created to support mothers of children who were born with clefts and those who love them. I'm your host, Laura Arroyo. Hello, and welcome back to the Our Forever Smiles Cleft Mom Diaries and Support podcast. I am Laura Arroyo. Before we jump into this episode, I would like to invite you to join this community to hear conversations with other cleft moms and advocates that will help you feel supported along your journey. All I want you to do is click on the follow or subscribe button. You can also follow us on Facebook, join our Facebook group. You'll be able to talk to the guests that have appeared on the podcast and just get more insights from other cleft moms. And let's just continue to grow together. Thank you so much for subscribing, and we have so much in store for you this year. Again, I cannot believe that it is 2025. As a note, we are not medical doctors, and we do not intend for you to use the information that we share here as medical advice. We are parents and advocates who love our children, and we are sharing our own personal experiences. Today, I have such a special guest. It's so funny because I met Brittnie through my own cleft team, which is really cool to be connected in that way. Brittnie is a stay-at-home mom of 3 kids, and her youngest was born with a surprise cleft palate, just like Giselle. So welcome, Brittnie.
Hi.
It's so good to have you on. As I shared, so for some reason I want to call her UNC Jessie, not her name. It's just her Instagram name.
All good.
But she is UNC Jessie. I've been connected with Jessie because obviously Giselle, my daughter, was born with a cleft palate. And so I've just met her through, of course, our own journey. And I started to reach out to her, and she also reached out to me because of this podcast, and she just wanted to make sure that UNC had representation and that they were connected to the community in a way that was valuable and thoughtful. And so we haven't been able to do anything in terms of a partnership quite yet, but we will have several doctors from UNC come on the podcast. So we're really excited about that. And Jessie reached out to me because Brittnie, it was one of their patients there, and she just wanted to be able to provide a patient experience because Brittnie, for some reason, was freaking out.
I was so scared.
So it's not for some reason, obviously. Obviously, we all have our moments. But yeah, so I guess we can start from the beginning then. So when did you find out about Ava's cleft?
I did not find out about her cleft until she was born. I was not trying to get pregnant at all. I just was married. I had my 2 kids, and it was just if it happened, it happened. We were content with what, the kids that we had, and it was just, if it happened, it happened. So I have 2 boys, and then I got pregnant with Ava, and we found out I was having a girl. So I was oh, 3rd time's a charm. I had a normal pregnancy, honestly. I mean, with all my pregnancies, I always have sinus tachycardia. So I always have to have C-sections. So I was not high risk, but I kind of was high risk in that category. So I had a C-section with Ava, and then I just kind of noticed after she was born, she cried, and then she would stop making a noise, but then she would scream again. But then it almost sounded like she wasn't breathing. So I found out about her cleft because they, told me that they had to bring neonatal in. She needed some oxygen. She was having a little trouble clearing some of the fluid. And then when I was in recovery is when the doctor told me that she had cleft palate.
Were you scheduled for your C-section?
Yeah.
Or
I had to
they have to schedule those,
right?
Yes. Yeah. And so after that, I guess they give you they give her the oxygen and she starts to recover. At what point do they discover hey, I guess what day, or did they find out the same day that she was born?
So it was the same day she was born. So after I had her, I decided while I was having a C-section, I was just going to get a tubal. I just was our family was complete at that point. I knew that this was it for me. So as they were tying my tubes is when all this stuff was happening. And I kept saying to my husband, Ralph, like, can you check on her? Like, what is happening? Like, I was just so confused because she was my third C-section. So I knew what to expect and I just knew something wasn't right. After that, they came over and they brought her over to me. They were still operating on me. And they said, she's having like a little trouble. We gave her some oxygen, but we want to see if maybe skin to skin will kind of help calm her down. So I was like, okay. So I breastfed my other two. So breastfeeding is always like a thing for me. It's important to me. If I can do it, I want to do it. So that's exactly what she was looking for. The second they put her on my chest, she was looking for something. So they're literally operating on me as I'm nursing my baby on top of me, right? Like the second she was skin to skin and I started nursing her, she calmed down like immediately. After that, when they wheeled me into recovery, is when they told me that they discovered that she had a cleft palate. So I did find out like pretty much immediately.
Hi, I am so sorry to interrupt the show, but I just want to tell you about today's sponsor. Today's show sponsor is Sienna Dawn Media Integrated Marketing Agency. Sienna Dawn Media is more than just a marketing agency. They are your partners in progress. Their mission is simple: to alleviate marketing bandwidth, allowing creative business owners to focus on what they set out to do: create. Sienna Dawn Media empowers creatives to thrive without the burden of managing their own social media and marketing campaigns. Visit siennadawnmedia.com.
And when they told you, what was your reaction to that?
I wasn't surprised, which is crazy because like every time I went to fetal maternal medicine and I got an ultrasound picture of her, I always said, and this was just like me being uneducated, to be honest with you, like I always said, does she have a cleft lip? Because every picture, like something just looked like different, right? Like, but her hand was always like on her mouth. So you couldn't ever really tell. And they were like, no, she's perfect. She looks great. She's perfect. So when they told me in recovery, I looked at the nurse and I said, I knew it. And she's like, how did you know it? And I was like, it was the craziest thing. Like, I don't know how I knew it, but I just knew it. Like, I just knew something was different. And she was like, you can't even see that on an ultrasound. So how did you know that? I was like, I didn't realize that there was a difference between the two. I really didn't. So that was like just part of me being like uneducated. But yeah, I knew it. Like I just knew it. It was so crazy.
You're gonna have thousands of people listening to this podcast. Like,
I know. Like, are you psychic? Yeah, maybe. It was so weird. Like I can't explain the feeling when she told it to me. I just was so like, okay.
yeah, like, well, of course I haven't gotten that reaction, but like people have said like when they've been shown like the ultrasounds and stuff, they are like, that's weird. Like, is that a cleft lip? Like, they just kind of had like a feeling about it. And that's happened a lot. Like, so I'm not really like all that surprised that you would feel like that. Like, I know with Giselle, like, cleft palate was definitely not on my bingo card.
Right.
But she always had her hands in her mouth. She's always been like a thumb sucker. I definitely didn't know it. And Brittnie and I have talked. So like some of this stuff I've already shared with her. But what they kept telling me is that she had a hole in the roof of her mouth. So they never said cleft palate. They just kept saying it's a hole in the roof of her mouth, which is like a very like, easy way, like a very like layman's term to like explain something to someone, right?
I agree.
But it was like I never even like made the connection that it's a cleft.
Right.
Because they just kept saying she has a hole in the roof of her mouth.
Right.
And so maybe if they had said like, hey, she has a cleft palate, then all of the other things that happened to me would not have happened.
Right.
So, but that like brings me to like your story. So like from that point of you finding out, right? And obviously you're thinking that you're nursing your child, right? When they put her on your chest, but in reality we know that that's probably not what's happening. I mean, they still have comfort, and you just can't provide nutrition for the most part. But there are other benefits of putting the baby to breast. What happened after that? Like, what are some of the things that you encountered immediately after finding out?
So after we got settled in our room, they told me in recovery that later I'd have like, a different doctor come in and they would talk to me further. And then from then on, it was just everything they can do to scare me is what happened. Like she said to me, she said, just want to let you know, we're going to do a scan of her brain, her kidneys, and her heart because all of that and the tissues develop at the same time. So sometimes kids that are cleft affected will have issues with one of those. And I was like, okay. So now I'm like, not realizing that she's going to have feeding issues, not realizing like all those things that kind of come with it. Like, not that I was in shock, because once again, I kind of had a feeling, but I just didn't know what type of life we were going to live like the next couple months type thing. So the doctor came in and they were still having me breastfeed. Like they were still having me breastfeed. The lactation consultant was like, try a nipple shield. And I just was so defeated because I've done it before. And like, I just didn't understand why it wasn't working this time. Like, I didn't understand. And they were not that they were like pushing it, but there was not at any point where anybody was like, well, since your baby has a cleft palate, your baby will not be able to form suction. Therefore, let's try, a Haberman bottle or like, the Dr. Brown's bottle. Like they literally had me sitting there fighting to breastfeed my baby who they knew was not going to get any nutrition at all. So finally, she passed her glucose test the first time. And then I believe they do like a 48-hour one or something. And she failed that one. So from then on, they had a feeding specialist come in, and the feeding specialist was like, oh, it looks like she's doing okay with the shield, but how do you feel about supplementing? And I said, well, I really like, I'd rather pump and bottle feed if I have to, because this is something important to me. But if my baby is starving, I have no issue supplementing.
Mm-hmm.
So she ended up coming in with like a Dr. Brown's bottle from the NICU. And she's like, yeah, it has like a special valve. And I was like, okay, perfect. Let's try it. And they gave her the formula and they took her to the NICU to do the testing. And while they had her in the NICU, they were like, we're going to keep her so that we can see how her blood sugar is. Because if her blood sugar, if she doesn't pass, it could now cause brain damage. So now I'm like sobbing. And this doctor is like, are you okay? And I'm like, no, I'm not okay. I appreciate all the information that you're throwing my way of things that could be wrong with my baby, but you're scaring me that something is going to be very wrong with my baby. So ever since they gave me that Dr. Brown's bottle, I just started pumping and bottle feeding her. And thankfully, everything came out okay. Like everything was okay with like testing, but I just am grateful that that one feeding specialist decided to tell me about the bottle, because if not, it could have gone downhill so fast for us.
Yeah. I wonder, so I am just so confused that like because you said that they knew that you wouldn't be able to breastfeed. So like the nurses and stuff, they knew, like, why didn't they give you the bottle to begin with?
Well, my whole thing is, and like, this is obviously something that I'm like passionate about, because like listening to your story and then, my sister-in-law and my brother-in-law, actually 8 months after I had Ava, they also had a baby that was cleft affected. And for me, I just don't understand why it took like a day for someone to tell me she can't create suction, like she can't nurse, let's try this bottle. I don't know why it took that long. Like, I don't know why it wasn't like a thing where it was like, right when she was delivered, that they were like, yeah, we're going to set you up with like a bottle and, figure that out for you. I like almost feel like I just don't know why. Like, it's like you starved my baby on purpose, or was that just like your negligence? Like, I don't understand that for me.
Yeah. And you mean like negligence from like the nurses
Well, I feel like
or
from anybody who knew about my daughter's diagnosis. So anybody who
yeah.
knew about it, I feel like it was very negligent on their part. because I didn't know. Like when you go in to have a baby, and something happens, like something goes wrong, and it's something that you're not familiar with, you're looking at the staff and the doctors at the hospital to guide you in the right direction and help you. Like you put your trust in them for your child and your child's health. So it's like, I didn't get that. So that kind of, like, I did, but I didn't. So that kind of formed like a big trust issue with like, medical personnel and stuff like that, for me at least at this point.
Yeah, I had the same feeling in the beginning as well. I felt like a lot of the nurses were just so uneducated about a lot of things. Also, I think that the thing that really tripped me up as well is them not saying that it's a cleft palate. They just saying that it's a hole in the roof of her mouth. I think if they would have changed the terminology, then I would have grasped what was happening. Um, and also, like for me, I was the first time mom, so all of the information was new. And then I had been like, I had been so ready, ready. And I did like all the research and stuff like that. And so I had already known that sometimes like hospitals will try to like if you're not getting enough milk, they'll try to like sway, like get them to eat. And so they'll push you to formula just to like, not give you kind of a chance. And so I was kind of feeling like they were doing that, but I was just like misled. You know what I mean?
Right.
Like they're like, no, you can't, or that you shouldn't, but they weren't saying like why. And it was just a lot of misinformation. And then the nurses were telling me like encouraging me to breastfeed while other people were telling me not to.
Yep.
And so being in that kind of limbo, I feel like you're right. Like it is one of those things where like why are y'all not on the same page?
Mm-hmm.
Like why are the same people in the same hospital like telling me different things? And yeah, like I can understand where your frustration came. And so they take Ava to the NICU, and how long does she stay there?
So they took her to the NICU to wait to see about her, like her blood sugar, and then they did all the testing there. So I actually was able to get her back a couple hours later when they retested her glucose, and it went up because she actually was like getting, fed this time.
Mm-hmm.
So it wasn't like a situation where like I had to leave her, and which I'm thankful for. Like I hear other people's experiences, and it makes me so sad, and I just kind of feel like that feeding specialist, whoever brought me that bottle, was like a guardian angel or something that day, because it made me not have to go through like the trauma that you went through. Like I know that you had, your experience and stuff.
Mm-hmm.
So it was a time.
And so after you were able to leave the hospital, like they gave you some Dr. Brown's bottles, and then was it like smooth sailing from there? What was it like going home with
So
her?
they actually only gave me that one bottle. And that's all they had. And it's funny because, you use the pigeon bottle, like we've talked about that.
Mm-hmm.
And that wasn't even like an option for me. Like they just told me like, here's the Dr. Brown's bottle. It has the valve, and that's that. And I conveniently had, because I used Dr. Brown's with like my other two. So I had all their bottles, but you can't buy the valves separate. So for me, I had to buy all new bottles. So from leaving the hospital, I had that one bottle, and super scary that Ava would actually silently choke every single time she would eat, every time after. So it was really scary. Like it got to a point where I said to the nurse, can you please come in and check on us like extra? Because sometimes I don't realize when she's choking and I'm scared to go to sleep. But she'll like I'll hear like her gasp for air, and that is her like choking. So they had told me that after I feed her, have her like sit upright for the 20 to 30 minutes, and then I could put her down after. But even after me sitting her up for the 20 to 30 minutes, she would still choke. So that was super scary for me. Like when we got home, we had extra bottles and stuff, and they gave me the number to the UNC Craniofacial Center, and I called them. And I spoke to Jesse and Garrett, and I just kind of like explained, I don't know where to get, the valves from. I have all the bottles. Like, I've never been through this before. I don't know anybody else who's clef affected. Like, can you please kind of help me. And like you can probably like understand where I come from when I say this, but sometimes Jesse's voice is just like what you need to hear. Like I don't know what it is about her, but it's like her tone and the way she like speaks to you, like it's like a USA. I just like I can't like I love talking to her. So she assured me like everything's going to be okay. Like we have you, you know, we're here for you. And she actually sent me a care package and it had some bottles with valves, you know, just some valves. So it was good. Like it helped us like get through, you know, like when we needed to use them and stuff. So
Yeah. Wow, that's beautiful. I actually, oh my God. I don't know how many times I've shared this story, but literally like that UNC team is like they're like a god. They were a godsend to me. They are so compassionate. It's like the word that I can say. And I just remember like our very first appointment and I was so anxious and going and I was going to the big hospital like the I don't know if that's where you see them. Yeah, you see them at the center, right?
Chapel
Like
Hill.
yeah, in Chapel Hill, and it's a huge university hospital. It's like so much action going on and all this stuff, and there's traffic, and you got to get into like the parking garage, and you got to make sure you're in the right parking deck and getting a parking ticket, and like just all this stuff, and like remember what floor you're on, and
It's amazing.
yeah, it's wild. And then I have this 4 week old baby and I am like lost and I am like leaking breast milk and they told me they were like, "Hey, make sure you get here like 30 minutes ahead of time because, it's crazy. They tell you that." And I was like an hour ahead and then suddenly I'm like late. And so I'm like borderline almost about to cry because I get sent upstairs and I get sent downstairs. It was like a mess. Anyway, I didn't make it to like where I wanted to go. I finally like get someone in the hospital and they're like, "Oh, they're trying to get to the like craniofacial center, but it keeps saying like this place is closed or whatever." It was just like wild. And this is when Dr. Wood's nurse was still there. And she got on the phone. We spoke to her and she's like, "You're fine, Laura. We're going to be here whenever you get here." And how like I like just that, like literally is like I could like cry every time I think about that moment because you know how like you schedule an appointment and it's like you're 15 minutes late and they just like cancel your appointment.
Yeah,
I was like 30 to 45 minutes late, but I was literally just in the hospital just lost. And
I know. It's so
and
bad.
I was like an hour and 20 minutes away, just out screaming because like I couldn't figure out her feeding.
Right.
And she's just like, "Laura, like, don't even stress about it. Like, we're on this floor and you're like, don't even worry about it. You're not late. We're here whenever you get here."
Yeah,
And I'm like,
it's what you needed to hear in that moment because you were probably like so frazzled by like everything, like just trying to get there on time and then having a baby crying and it gets frustrating. So just hearing somebody like just say, like, it's okay, like, you know, take a deep breath type of thing. Like sometimes we need that.
yeah. So, how did you get connected to UNC? Like, what's the process? So, you get home and you have these bottles and stuff and you kind of figured out, but like, how did you get connected to the team?
So it's so strange because I know like I think you've said that when you like at UNC, they didn't refer you, right? You had to like go to the pediatrician
Yeah.
after. So Wake Med, because I had her at Wake Med, and they actually referred me. They asked me, they told me, they said, you know, there's two craniofacial teams here. There's Duke and there's UNC. You tell us where you want us to send the referral. So I was like so surprised when you didn't get the referral because I would have thought like from you being UNC to UNC, you would get that. So they actually asked me, and I had put on like a mom's page in my area, and I had asked, and there was two people that commented on it. One went to UNC, one went to Duke, and they were like, "You will not be disappointed either one you choose." So I don't know, for some reason I was like, sure, UNC, like let's do it. Why not? So they actually referred me. So after they referred me and we were home, like I have anxiety bad. Like I called immediately, like the next morning when we got home, and I was like, hi, I think you got a referral for me. I just wanted to call, like, introduce myself, tell you that I'm terrified of everything that's about to come. Like, what do we do from here? So then, and that's like when I spoke to Jessie and she sent that care package. So yeah, I got the referral like at the hospital, and then we had our appointments. They actually also referred us to a feeding specialist. So we saw a feeding team. We still do, actually. And that, I feel like I needed that. Like, the feeding specialist was so important to me because, like I said, she silently choked the whole time. And it was terrifying to feed her, especially like in the middle of the night. So yeah, I mean, we got connected right through the hospital.
Yeah, I think maybe because I know maternal fetal medicine will refer you as well. Because like, moms that get their diagnosis during their ultrasound, they will often get referred at that moment
Right.
too. And then also like if they're under like the maternal fetal medicine care. So I think maybe because I didn't have any like they started talking about teams in the NICU. So whenever Giselle was almost ready to go home, they asked me about it. I mean, they of course it was at a UNC hospital, so they were kind of biased, but they didn't refer me until I got to the pediatrician, and then that's when I got connected to everyone from there.
Which is crazy
But
to me.
yeah,
I could go on and on about hospitals and this, girl.
I think maybe, well, I don't know, maybe they're not allowed to just like refer their own just because there's two teams. Like maybe there's something to that. Like, I don't know.
It's such like a strange like protocol then if that's like what they're following. Like, it doesn't make sense to me because it's like you have a baby, right? And your baby is born with something that's life-changing, and in turn that changes your life, and you're just sent home to figure it out without speaking to anybody about it. Like, that to me is just so crazy. Like, I get it, as moms and as parents, like, we need to boss up and we figure it out. But like, you have to literally like live in fear for like the couple weeks until you can go and talk to the specialists that know everything about this. It just doesn't sit right with me. And I will never understand it.
Yeah. I think I mean that was like really challenging. Like we didn't really even get Giselle's feeding down right for like weeks. Like literally weeks. Like she was discharged from the NICU, but she still like we were still doing the Dr. Browns at that point, and it was not working for us. And so that's when we went to the feeding specialist, and we were able to switch to like the pigeon bottle and stuff like that. I wanted to talk a little bit about the silent choking though. That is something that I didn't experience like on the regular with Giselle, but I did experience it. And so did you ever figure out like why that was happening or why that happens with children born with cleft palate?
I remember the first time we saw Dr. Leeper, I brought it up and I kept bringing it up. And it was like, like maybe she has reflux. She would spit up a lot too. Like, I would pick her, like, I would wake up, right, to like give her feeding in the middle of the night. And like her bassinet would just kind of just have like a big, like, puddle of, spit up. And I never like heard her spitting up. Like, it was so silent and it was so weird to me. So Dr. Leeper, who is her surgeon, she actually gave us the whatever the generic brand for the Pepsid is for her. And I started giving that to her, and it did help with like the quantity that she was spitting up. But she still constantly did it. I want to say she actually didn't outgrow the silent choking until she was like about 5 months old. Other than that, we
Yeah.
just kind of struggled a little bit through it. But I mean, we made it through. It did, like, nothing helped. Nothing helped. Nothing made it worse. It just happened.
Yeah. Did you use breast milk the entire time, or were you like doing half and half? How did you feed?
I still pump and bottle feed her now, and she'll be 11 months in 8 days, which is crazy. I don't think I was like, I had like a good, I was making a lot. But I think it was different because I stayed home with her this time. So I was making enough to like bottle feed her, and then anything extra I always like put in the freezer. So I always had so much milk. So I've been able to breastfeed her this entire time. Well, exclusively pump and bottle feed. So
Mhm.
I felt like, and that has been trying. Like there have been so many times where I've just been like, I can't do this anymore. Like I want to throw my pumps on I-40. I can't physically do it anymore. But here I am still doing it.
Yeah. No, I asked because I was also exclusively pumping, and and Giselle had really bad reflux as well. One of the things that they shared with me though is like it's not really as much as you think it is, because I was thinking like this is a lot. Like this is a lot of spit up. And they're like, "No, it looks like it's a lot, but it's really not." And I just, listened to whatever they were saying, and maybe it is, maybe it's not.
Right.
But the one thing that they did talk to me about the ENT was they said breast milk is easier to come up because it's like lighter.
Right.
And then and so they're like you could, put some formula in it to kind of like thicken it up just a little bit and see if it helps. And then the other thing was like going on an elimination diet. And I was already like too stressed out to like, okay, is it the coffee? Is it the milk? Like to do all of
Yeah.
that. So that's when I eventually kind of just gave it up. And it did resolve once I stopped exclusively pumping. Um she didn't spit up. So I don't know whether it was because like, hey, something in my breast milk, or if she just grew out of it, you know what I
Right.
mean? Because I was probably like 5 or 6 months when she had her last like breast milk. So I don't know, but it definitely is something that I feel like happens a lot. Like people talk about in the groups, like how their babies kind of like spit up a lot and like have a lot of reflux with all of the gas, I guess, that they're getting from the bottle,
Right.
like from like biting down on the bottle and stuff like that. So yeah, definitely something to think about.
Yeah, I know like dairy allergies is
Um,
like a big thing, and I think it was like a dairy thing. So I had to cut out dairy out.
yeah.
Yeah, I did cut out dairy, but she still did it.
And so you said has grown out of it though now,
She
right?
has.
Like she's not.
Yes.
Oh God, because it's like the worst. Thankfully, because it is the worst thing. It really is. It's the thing that really kept me up at night as well. I'm like, she needs to be eating, and she's like she's throwing it all up.
The most heartbreaking thing for me was when it would come out of her nose.
Yeah. Now, did she have any concerns? Did you have any concerns about her weight at all ever?
No, honestly, she is still to this day, she's pretty short, but we haven't had any weight issues. She always like grew at like a very rapid pace as far as weight. There was like one time that she wasn't gaining weight at like a rapid pace, but she also was going like 8 to 10 days without pooping. But she also wasn't super
Mm,
uncomfortable. So I remember saying to the pediatrician, like, I don't know, this doesn't sound right to me. And they said, oh, well, when you're breastfeeding, sometimes they can go like a long time without pooping. And I was
longer.
like, yeah, but that didn't happen with any of my other kids. So you're kind of not selling me on that. So when we went to her feeding specialist appointment, I was like, yeah, I just don't understand. Like she's eating double, but she's not pooping, but she's not gaining weight at a rapid pace. And if she's not pooping, then where is it going? Because she's not gaining the weight. Like it makes sense to me. So she was like, well, she's try, like a level 2 nipple because and that's what was happening. She was burning more calories than she was taking in because she was taking longer to drink a bottle too. So that ended up resolving itself. And other than that, she's been good.
What are some questions that you asked your team like initially that you think were, I don't know, helpful?
Um, that's a loaded question because I am like an over preparer. I never stop asking questions. It's bad. I am really grateful and happy for the group that you've created because that's where like I'll ask a lot of questions and then those questions is what I actually end up bringing to the surgeons. Like when people ask questions, I'll like screenshot them and then I'll, go to the appointment and I'm like, hey, this person suggested this or had this issue. Like, what do I do if this happens? So that's a really loaded question.
That's funny.
Yeah. I ask everything and anything.
Yeah, but that's a great approach, right? Like for someone that's listening, like if you're in the groups and you're like curious about something, you can screenshot the question and present it to your surgeon or your team and just say, "Hey, what if this happens? What should I do? Who do I call?" Right? Like in
Right.
case like I have this issue, cuz I think that's a big thing too about like who are my point of contacts for everything. And so recently Ava had surgery. She had her palate surgery. I'm so excited. So I met Brittnie pre Ava having surgery, and I will tell you all, when we've had all these concerns. Brittany's concern was she did not want Ava to get sick.
Yeah.
I'm like, that is the last thing on my mind.
I know. Yeah, I quarantined for a while.
Yeah, so speak to that. Like what I guess what initiated that like fear? Like what were you thinking or what was your like worry or your concern?
Okay, so so she has two brothers that are in school and flu. Like, I don't know why I decided to say, yeah, let's do surgery in January, like the middle of, like flu and RSV season. Let's go for it. I don't know why I decided that was a good idea. But I remember I was listening to your podcast. I was listening to an episode and I don't remember her name, so I apologize. But I think her son was going in for either a lip or a palate repair, and he had a runny nose. And she had asked the surgeon, like, hey, he has a runny nose. Like, is it going to be okay to do the surgery? And they're like, yeah, it's okay. Kids get runny noses all the time. And then later on, I guess it was the start of like a respiratory virus, and that poor little one ended up on, I think, like maybe a ventilator. I don't even remember, but it was like traumatic.
Oxygen probably.
Yeah, it was like traumatic for me to hear. So I was like, oh my gosh, like I need to make sure nothing happens, because I do not know if I physically am strong enough to go through something like that. So that was like why one of my biggest concerns was her not getting sick. And she didn't, but then she got the flu like 2 weeks after her repair.
Yeah, I know. I saw that. I tell parents and I like I'm never trying to be like negative, but like in the groups I'm like people say like, "Oh, my kid has a runny nose and like we have surgery in like a week or two and I just want to see if like we'll be able to like get in." And I'm like, "Please, like please, I have heard too many stories."
Yeah.
Like I would reschedule. Like I would reschedule a month out. If like my daughter, like anesthesia is nothing to play with, everyone. We have seen and heard the stories. Like your baby can end up on oxygen and that is not a good thing. And Giselle went to get her tubes and the anesthesiologist, she was getting over a cold. Not even a cold, she just kind of had like a cough. And, he goes in to see her before and he's like, has she been sick? And I'm like, well, she was sick like 2 weeks ago. And he's like, well, I will do it, but I wouldn't, if she were my daughter, I wouldn't. And I'm like, that's like all I needed to hear. Because it's like because I think like they feel such pressure from the parents, and it's true, like you lead up to this big surgery and you really want, it's like I have written about this before too. It's like I waited so long for her to be whole, right? Like to have this surgery, this moment, right, that we're gonna have. And then it's like, we didn't get our surgery canceled, but like I can't imagine how parents feel when it's like, oh, sorry, another 2 months, another month.
Right.
And it's like, wow, I built up all this anticipation for this. And so like I get it, I get why it's heartbreaking to have like a rescheduling, but it's no joke. Like anesthesia, do not put your kids under if they have a cough, if runny nose, nothing.
I could never like imagine. I just can't. It's so scary. Like, and you're right, like building up the anticipation for something that's so big, that's going to happen, that's so life-changing, and like you just don't want to do anything to like jeopardize that. It's always better to play it safe. No harm in playing.
Yeah, and it's like they're gonna get like rescheduled. So
Right.
yeah, I mean, I don't want to be dismissive of it because it's really hard, but it is like that was like literally all he needed to tell me. He was like, I mean, I can do it. It's like a 10-minute surgery, and he's like, but some parents come in here for one thing. We're coming in here to put her ear tubes in, but like you'll be leaving for something else. Like I mean, no, he's like, you'll be staying for something else, and I'm like, like he's telling me this, and then I've seen countless kids. Like I'm in the community like so much. I see so many parents. I talk to so many parents, and their kids have ended up on oxygen for like various reasons. Sometimes people don't know, but it's just better to play it safe. So anyway, that's like my tangent. That
Right, it's all good. Yeah, I respect surgeons and doctors that are like that. Like sometimes it may be something that's like hard to hear, but like I'm the type of person where I don't like any surprises. So like even though maybe I feel like what you're telling me is not in the appropriate tone, or maybe for some people they'll be like your bedside manner stinks, like that's fine. Give it to me straight, because I do not want any surprises at all.
Yeah. And he was so kind. Like I mean, he's at UNC. He was so nice. He just told me, he's like, I can do this, but if she were my daughter, I wouldn't.
Yeah, and that's
And I'm
appreciated,
like,
I
oh
feel
well,
like.
thank you so much for telling me that, because we're leaving.
Yeah.
So back to Ava though, this isn't about me. So she's had her surgery, and so aside from like quarantining and like worrying, what what else did you do to prepare?
So I wrote on like the page and stuff and asked, what are some things that you wish you would have asked your surgeon, or what are some things that you wish you were told to bring. So somebody told me about these drool bibs, and I ordered those. Like I was ordering everything you can think of. Um, Somebody said that their child did not sleep in the crib that they have, so ask for another bed. And that was like another thing too. Like I think my perception of like what everything was going to look like after like her repair, like so when I was talking to the surgeon was like, listen, I'm going to tell you right now, like, I'm going to hand you your baby, but your baby is not going to be the sweet little Miss, Ava. This surgery is extremely painful, and you're going to have extremely challenging days. So from like that point on, I was like, I am terrified now. Like now I'm really scared. So, I have a whole house to feed. So I did like all the meal prepping and had my freezer stocked with meals and had our bags packed. And you were awesome, and you sent me a cozy coo, which thank you, because to be honest with you, that was the lifesaver right there. If anybody asks me, what can I do to prepare for a repair surgery? That's the first thing that I'm telling everybody. A cozy coo.
Get a cozy coo.
Yes, because I had like a Houdini on my hands. She flung the no-nos off at every chance that she got. It was crazy to me. But yeah, I just tried to do everything I can to like make everything as simple and easy as it can be for, after her surgery.
Yeah. And what was recovery like for you all? Like once you were finally in it, like how did that go? Kind of like explain that day. Did you go by yourself? Did your husband go with you?
So we actually had my aunt fly here to help us, because she's a PICU nurse at Cohen's Children's Medical Center. It's like one of the best children's hospitals in New York. And my husband came with me. We stayed at the Ronald McDonald House the night before. So, somebody had also told me on the Facebook pages, like, button down onesies, because for the wires and stuff. We stayed at the Ronald McDonald before, because the hospital is like an hour away. And we got to the hospital, I don't know, I want to say like we had to be there at 6, I think. So we were there at 6, and I just was like a disaster. Like I was trying to hold it in so bad, right? Because like I didn't want like them to think I was like unstable and I wasn't gonna be able to like get through this. Um, so, and she was like so cute. Like she was cute as can be. Like, my husband Ralph was with me, and they took her, and she just was like so happy. And when she woke up, one thing I was not expecting was, the drooling. I knew she would drool, but I didn't realize like my whole sweatshirt was covered in her blood. And I guess because like it was mixed with drool, it looked like it was like so much more blood than it really was. But I just wasn't expecting that. And I guess because of her having the breathing tube in when they were operating, she had so much mucus and she was having a really hard time breaking it up. Because, like, for us, we're adults, right? Like, we wake up and they're like, can you cough for me to kind of help clear it? But she's a baby. She doesn't know how to do that. So they had to give her some albuterol and they gave me like a baby mask for her face and they had me use it to like cup the back of her to help break up the mucus. But that was like the biggest thing. She kind of sounded like very, very junky. She didn't want to cough. She just wanted to sleep. So she slept like most of the day. They let her sleep. And I remember saying to Dr. Leeper, like, please tell me everything that is to be expected, because I'm scared that they're not going to know what to do when I get up to that floor post her repair, because I've had that happen before, right? Like when I gave birth to her. So Dr. Leeper was like, they all know what they're doing. Like everything's going to be fine. I will check on you extra. So the hardest part for her was she was pretty good with pain management, but she did not want to eat the first day. They told me it was okay. She's on fluids. Don't force it. It's all good. She's okay. Our night nurse was like, not the greatest. Ava was on Tylenol, Motrin every 3. And then they also gave her Oxy because as she started waking up like overnight, she was screaming. She was screaming her head off. And it was like just during shift change. And I was so aggravated because like normally I feel like nurses are like, hi, my name is blah, blah, blah. Like I'll be filling it. Like I'll be your night nurse. If you need anything, let me know. She did not do that. And my daughter was screaming bloody murder. So now I'm like, I don't know what to do. I'm doing everything I can to try to comfort her. She's not due for any pain meds yet. Like, my husband was like, hey, like, can you give her anything? And I guess it also kind of just happened at like a bad time because she was also like coming in, but she could not be less attentive than she was. And she just made the whole experience overnight so bad. After my nurse kind of was like, kind of gave her some nurse terminology, I guess she like realized like, oh crap, like she does this stuff for a living. Let me like be more attentive. So honestly, the first night was awful, but then the recovery following, it really wasn't that bad. She was pretty good with pain management. She did not want her Dr. Brown's bottles. All she wanted was a pigeon bottle. So I had to switch all her bottles. And, I was talking to one of the nurses there and I was explaining to her, like, she had asked me like, oh, did you know that your daughter was going to be born with a cleft, palate? And I was like, no, because like, you can't really see it through like an ultrasound. And I got into this conversation with her and it sticks out to me because, I had said to her, like, sometimes I get super jealous of moms who have kids that are born with a cleft lip because I feel like 9 times out of 10, they go for like a scan and then they're told what they're going to be faced with at that appointment. And from that point, you have, months of research that you can do, different bottles you can try, just all different things. Like you can mentally prepare yourself for that. And you don't do that. Like you can't do that when you have a baby that's born with a cleft palate. And I also feel like too, like in hospitals and stuff, like if there's not like a cleft lip associated with it, like with their palate, like they don't know how to treat your child. And I've seen it. I've seen it with my daughter and I've seen it with my nephew. And that mind boggles me. And the nurse agreed with me. She said that there have been patients where the doctors have not been able to diagnose them properly. And she's had to actually tell doctors, like, no, this child has a cleft palate and that's why they're having issues. And that is crazy to me. And that just doesn't sit well with me.
Yeah. I've always felt like that too, like this feeling that people imagine that you have it easier, maybe, like because you're not lip affected. And I'll be the first to say, like, I'm grateful, right?
Right.
that my child doesn't have like the experience that someone
Right.
that is born with a cleft lip is gonna have. Like I truly am, but I think that I don't know. Sometimes I find myself in that mindset of like what do they call that? Like competing trauma. Like
Right.
what
No,
how do you
like
call that?
100%. Like I know
So,
exactly what you're, yeah, I get it. I'm with you on it because I find myself with like,
it's like I have it hard
right,
too.
right. And that's like how I feel like I get it, right? Like no matter what cards we're dealt with in life, there's always going to be something where we're like, you know, oh, well, I wish it was this way instead, or oh, I would have, preferred maybe this instead. Like no matter what, I feel like there's always going to be something that we're not happy with, right? Like, and that one thing that got me through like Ava and her diagnosis was okay, it could be worse, right? Like there are worse things that happen to children, and I'm very very big on like God does not give you anything that you cannot handle. And I swear by that. And that's all I kept telling myself like during Ava's, this whole process was I can handle this, I can do it. Like I don't have a choice, right? But I do, like I am just so like I get so jealous sometimes because I'm like, like to be able to prepare and not be just like surprised and
Mm-hmm.
like kind of figure out how to handle this like as you go. Like I don't know, like I'm grateful for Ava having, cleft palate and nothing, that could be, more serious, right?
Mm-hmm.
But yeah, I mean, there's challenges in everything, right? There's challenges in everything we deal with. I'm sure there's things that parents who have children that have cleft, lip and palate maybe are like, oh, I wish my child only had one, and not the other. So I
Yeah.
think it kind of it goes both ways, right? So I don't know. I get jealous though.
Yeah, I think so. The thing the thing that I don't that I just like when I start doing is and I kind of have to like check myself a little bit, but I hate when I start feeling like I have to justify what I went through.
Right.
Like have to say like but it was really hard or like to like kind of over explain how heartbreaking that experience was, how like crazy I felt, how just like my world turned completely upside down. And, it goes back to what everyone says, right? Like, just an easy fix. It's like, I hate having to feel like I didn't go through anything hard. And when it was like, the hardest, the hardest thing I've been through in my entire
Yeah,
life.
I agree.
Yeah, so that's been like a real challenge. You mentioned that you have other children. You have two
I
boys.
too.
And so how have you been able to like balance all of this, especially with two boys? Like they're full of energy.
Yeah, my boys are crazy. I have two boys, Ralphie and Dan. Ralphie is 6 and Daniel is 4. Daniel is my middle wild child, and I was really scared actually for him. I was, he's in speech therapy, he's been in occupational, before, so I have my own challenges with him. So I think I was more scared about how I was going to do all of this, like, especially with him. But honestly, they are so nurturing. They are so loving. They are so caring. They are so helpful. They love their sister. They love anything, that they see. And Ralphie is like pretty good too. He's like, oh my God, no, she can't have that, or, oh, mom, so it helps. Like I thought it would be a bigger transition than it was. I was really scared. But I don't know, as wild and crazy as my boys are, they're they're the best. They're awesome. It's been pretty good.
Yeah. Oh, that's so sweet. Like, when did you start telling your like extended family or them about, or have you talked to them about her palette? And what about like your extended
So
family?
it took me a while to July, I believe, is craniofacial awareness month,
Mm-hmm.
right?
Mm-hmm. Yeah.
That's when I like actually like put it out there on social media. I told my immediate family, my dad, my mother, like right as it happened. I was just like a disaster. And I did tell them right away, but I didn't want to go any further with explaining it to anybody else because I wanted to make sure that I knew everything about it. Because obviously, when you tell somebody something that is common but not super common, like nobody who's been through it before, like genuinely, people are curious. They ask questions. So I just didn't want to overwhelm myself with not having an answer. And then them saying something, and then it just kind of like caused more anxiety for me. So our family knew in the hospital. I explained it to them, but I did not, really tell anybody else or really even start talking about it until July.
And what was your husband's reaction to all this, or how what were his feelings through all of it?
My husband is German and Irish, and he shows no emotion at all. I was like, I was scared when I found out we were having another baby. And I remember crying to him. And I remember saying to him, like, some people say like 3 is a lot, right? And I'm so nervous that this is just going to be so much pressure and it's going to like break our marriage or something, like, are we going to be okay? And then when Ava was born with her cleft palate, like, I was like kind of more scared. But to be honest, like, he's a man of few words. He never really says anything. If anything, he's the one telling me like, it's fine. Like, it's not the end of the world. Like, we're gonna be okay. So he did step up like a lot. Like, I focused on Ava and he focused on the boys. So like, all in all, it was good. Like, great partner to have in that aspect, right? Like, he doesn't make me freak out. He kind of makes me seem like I need to like tone it down a little bit. But I do think, I don't know if it was because she was a girl or not, but he would get mad at me when I would say it. But like, I feel like he wouldn't like take the initiative to like do things sometimes, and it made me feel like maybe he was like a little scared. And anytime I would bring it up, he'd be like, how dare you say I was like scared, and I'm like, then why aren't you like jumping in, like, I kind of felt like I was figuring it all out like on my own. But he did ask a lot of questions, and after a couple months, he tried, to be more like hands-on. But in that moment, just him focusing on the boys so I can focus on her in the long run, that's what I needed. He knows what I need
Yeah,
sometimes and when
that's
I don't. So
yeah. I mean, I think that that's a common response too. Like I ask people that question and they're like, you know, their husband was just kind of like, just chill. Everything's gonna be okay.
yeah.
Like,
Yeah. No,
it's
for
like,
real.
I can't chill. What do you
Yeah,
mean?
like, I was trying to figure out, like, in the hospital, I'm like, "Why did this happen?" Right? Like, and it's so
Mhm.
it's so crazy to me because I remember laying there and I remember crying and I was like, "Did I do this? Like, did I do this to my baby?" And I was Googling everything, and he was like, "Britt," he's like, "You can Google forever. You're not gonna find out why this happened. It happened, and it's okay. Like, you have to move on." And I was like, "Yeah, you're right." But I still think that way though. Like, did I do something? Like, how do you not think that way? It's okay.
Yeah. I don't know. I don't. I
Really?
don't think about it at all. No.
Like,
No.
I don't know. I think about it sometimes.
I feel like we've talked about this too,
Yeah.
like in our conversations. Like, I don't like, I don't know. I just, like, they say 6 to 9 weeks. I wasn't doing anything that I wasn't supposed to.
Right. Yeah.
Like, I mean, I could go down this like rabbit hole of like, okay, I was taking the pre workout. I was like drinking a lot of
Right.
coffee. Like, I went to New Orleans like right before I got pregnant, you know?
Right.
It's like all these
Right.
things that like, like
Then you mentioned how sick you
maybe.
were and how the prenatals and stuff,
Yeah, I
mentioning
was sick and
right.
like I took my I did stop taking prenatals, but I was not taking them
Right.
regularly. And then I started taking like folate directly, like not the prenatal to see if it would help.
Mhm.
But that was like later on down the
Right.
line. That was like whenever they say that the face is fully formed already. So I don't know, like I don't think about it.
I just like, I don't let it eat me alive anymore because, Ava is a little bit developmentally behind, so she does go to physical therapy. She's not as far behind as she was, but she is a little bit. But like, now that she's like reaching all her milestones and stuff, like, it doesn't matter to me. Like, when my nephew was born 8 months after her with a cleft palate, like just a cleft palate, like, my brother-in-law, he called me because they needed, my help, and he turned to me and he said, "Well, at least you know that this is genetic." And not to say that like it made me feel like comfort, I just was like, wow, like I could put it to rest. But it's not genetic. It's not, weirdly enough. Yeah, it's not genetic.
So wait, did you get tested?
So my nephew did. His cleft
Okay.
is not genetic, but they will not test Ava. Like when we saw the genetic counselor and she looked at Ava, she didn't find anything that she thought that she would need to get tested for. And I've been trying to get my daughter genetically tested for since like my nephew was born. He was born 3 months ago. It's like impossible. I don't understand.
Yeah. I'll see if I can find a resource for you. But cuz I think there's private, the problem is you're going to have it privately
Right.
done. But but the thing that I do want to say about genetics, and I don't want to drag this on or anything, but I know specifically that they don't test for
Right.
everything. They only test for what because it's just so like intricate.
Right.
You know what I mean? Like there's so many different things that they could possibly test for. They're not going to test for everything. And so for Giselle, I know that they tested for like 22q
Hmm.
deletion, and then they were also looking for like PRS.
Yes.
But that was because she like they thought that she looked like she
Because
had
her
it.
chin or her jaw, right, when they were doing
Because her jaw is
surgery. Right.
small, but it's just the shape of her head. Like her dad's head is. Just in thinking about, all of the things that you went through with Ava, what do you think is something that you wish people knew about children born with a cleft lip or palate?
I think the most important factor of it is just the feeding. Knowing that, when you have a baby that is, affected, like please tell the lactation consultants and everybody that like, no, this is not going to work for me. Can we try this instead? And that to me, like if I would have just had that from the beginning and I would have known that from the beginning, then I think I would have had, like a different experience. I think that's like the biggest thing, like I really do feel as though like nurses that are on, like a NICU floor or a mother baby unit, I really do think like they need to go through their certifications every year, every 2 years, to know what to do. If you say that you have a hospital that has a NICU, then you kind of should know what to do in case any child has any type of a feeding issue. So that for sure is the biggest thing for me was feeding and hospitals having supplies for that too. Knowing what you
Yeah,
can use to
I've
feed your baby.
Yeah, I've heard that a lot. Like I've heard people share that. But then, I've also spoken to nurses that say like, I don't know why this was an issue for you because in my nurse training, we were talked about this extensively. And I'm like, wow. And like, I've heard like different
Right.
things and I guess I don't know, the longer you are a nurse, some things you might forget, right? Like I don't
Right.
know. That's why I feel like that's true that retraining is probably
Yeah.
important to have. And just in saying that, I know you said that the feeding, was the hardest part of your journey. Where I'm assuming
Yeah.
that, or would you say like learning about your diagnosis or surgery?
Honestly, I just think the feeding was an issue, right? Like her reflux, all of that, figuring out which nipple is good for her and all that stuff. When it came to solids, that to me was a whole new ball game. Like, and I was scared about a lot of stuff. I really, really wholeheartedly think that I don't know, feeding wasn't the hardest part, but I do think that it plays a really big part in a lot of people's journeys. So I think just having the information and the tools and that type stuff is honestly what would help and make a difference. Sometimes you have to school people because sometimes like, they like I said, you put your trust in it, right? Like when you go to a hospital and you have a baby and you trust that what they're telling you is the right thing to do. So it's really, really hard and, discouraging to know that like they're kind of like not telling you the right thing to do. So you just have
Yeah.
to know yourself.
No, it's tough.
Yeah.
Yeah, it's tough. I always tell people to advocate for themselves too. People are afraid, and I understand. And I probably didn't advocate for myself the best that I could have during that. But I've learned so much just in talking to people, and also just like going through my own journey. Like ask questions,
Hmm.
like tell them to do things differently. Like you don't have to do what they tell you to do.
Yeah. A hundred
You
percent.
have a voice and a choice, and it's your baby.
Right.
Like
Yep.
what do you think your journey has taught you
Um, I
about? life.
Exactly what you just said about being the biggest advocate. Like, it doesn't matter if your question sounds like super self-explanatory, ask it, right? Like, who cares? Because at the end of the day, like, you need to know what to do to care for your baby. There is no question that is too stupid. Like, do the research and just be so prepared whenever you go to a doctor's office. I mean, like, for me, I always felt like being one step ahead was what helped me. The more that you're ahead, the more questions that you are prepared with, I feel like the better it's going to help ease your mind. And I feel like when you're calm, you can care for your baby properly. So just advocate and just
Yeah.
ask the questions.
Well, I talk to Brittnie all the time, so if y'all want to talk to her, you can see her or chat with her in the Facebook group. So it's so wonderful to actually have you on and to share your story with
Well,
everyone.
thank you for having me.
I feel like, I get to talk to you, so I know, like, I've heard a lot of this. Brittnie is very passionate about feeding and nurse education, and I think that you're gonna do great things, after everything settles, right? I think that you'll be able to kind of see what you want to do in the community in terms of like using your voice, because you're obviously so passionate about this
I
and you want things to change for these babies.
I
So,
do.
yeah.
I just don't want
um,
anybody to go through like what you have gone through, like your experience, or, for my nephew, like
mhm.
that's traumatic. So everybody needs somebody.
Yeah, for sure. So thank you again, Brittnie. I appreciate you being on.
Thank you for having me.
And thank you all for listening to the Our Forever Smiles, Cleft Mom Diaries, and Support podcast. Be sure to subscribe and submit a review of the podcast wherever you listen. I hope that you've enjoyed this audio experience. Maybe you cried a little, laughed a little, but more importantly, I hope that you feel a little piece of reassurance and even joy in your journey. Talk to you next week. Hey everyone, it's Laura here. I'm popping in today because I need your help. If Our Forever Smiles has ever helped you, if you've learned something new, felt less alone, or found hope through this podcast, then I'm asking you to help keep it going. Creating this podcast, sharing stories, and building a space where Cleft families feel seen and supported is something that I pour my heart into. But the truth is, I cannot do it alone. If we want to reach more families and provide even more resources, we need your support. So I thought of a creative way to do this. For just $2 a month, you can help ensure this podcast keeps going strong. For $5 a month, you'll unlock exclusive moms in real life content, real unfiltered conversations about motherhood and career and everything in between. And then for $10 a month, you can get everything plus exclusive merch to show your support. If this podcast has helped you and you want to see it grow to help other families that are probably facing the very same challenges that you are facing right now, please consider supporting us today. Every dollar goes toward making a difference for Cleft families just like yours. And right now, we'll be using the funds to elevate the show for production. So we'll be able to add more video and just get new equipment. And as soon as this community is established and we're able to do more, we definitely plan to go beyond the scope of just this community. We want to be able to support scholarships for new craniofacial surgeons. We want to be able to support global surgeries and just really spread our efforts to continue to make an impact in our community. I just want to thank you in advance, and I'm just so grateful that you all are able to support me and support this community here. And it's definitely something that I'm really looking forward to. The link is in the show notes, and I just want to do a shameless plug here. The Moms in Real Life podcast is so cool, so candid, and yeah, it's definitely something that you'll want to check out. Thank you all again.